The controversy over this year's costly Calvo Select Care health insurance contract seems never-ending. The huge $20 million increase in cost last year became a major campaign issue, creating an unfunded liability for GovGuam that, in part, took a supplemental budget to solve this year. Now, Vice Speaker B.J. Cruz believes Select Care should pay some of that money back.
There's about $8 million that should be coming back to the people, either to the government or to the individual subscribers in individual rebates that they're supposed to be receiving.
That's because of a federal law, the Patient Protection and Affordable Care Act, which, Senator Cruz maintains, requires that a rebate be paid if the insurance company's medical loss ratio is less than 85%. That medical loss ratio is what an insurance company pays out in health claims to the customers they insure. The effect, says Cruz, is to cap profits at 15%.
The law requires that for any plan with over 100 enrollees, that the medical loss ratio should be 85%, or your profit margin should only be 15%. And that excludes taxes, but since they have qualifying certificate and they don't have any taxes, then that's not taken off the top.
Cruz goes on to claim that 4 insurance companies and the insurance commissioner actually wrote to the Department of Health and Human Resources asking for an exemption from the 15% cap on profits.
HHS wrote back and denied their request. So the 15% is applicable on Guam. The question was when. And my reading of the law is it was effective the 5 days before they signed this contract.
Although some industry analysts say that the new medical loss ratio limits went into effect only on January 1st of this year, Senator Cruz is so sure that a rebate on the excess profits is due that he introduced an amendment to the budget bill during session this morning.
With the very large increase in our premium, I really am confident and hopeful that my figures are conservative, and we may realize in the upcoming fiscal year even more than the $6.5 million that I projected using a 73% medical loss ratio.
And individual GovGuam employees enrolled in the Select Care Health Plan would in turn be entitled to split the remaining $1.9 million rebate, says Cruz.
Probably headed for court, though.
Yeah, but whether or not it's paid, whether or not we need to go to court and it's going to be paid next July or next August is irrelevant to me. It's revenue that we're going to be receiving in the next fiscal year, and it should be taken into account.
Kevin Kerrigan, PNC News.